the beginning, I will teach about the skin-to-skin contact, and after that, I will teach about breastfeeding. And yeah, first I will introduce Yui Clinic. And so Yui Clinic was thought of originally to cater to Japanese patients. The main objective of the clinic was to support breastfeeding and family bonding. However, in 2012, an American couple approached us and told us their intention to have a natural birth at the clinic. At that time, we didn't have any translators, or the clinic was not prepared for foreign patients. Some of our midwives in the clinic can speak English and understand English, but others cannot. Starting that time, we at Yui Clinic have been working on improving all our services for our foreign English or English-speaking patients and clients. And this is about my experience. So some books I read gave me insights on gentle birth for baby. The books mentioned about reincarnation, and I believe that. After reading the books, all I wanted was to be with my baby after birth, so I decided to have my birth at home. Recently, some patients wanted to give birth at home. Our clinic can support home birth, but the patients have to realize the risks involved. The patient might encounter some trouble or difficulty during giving birth. In case of emergency situation, it might be difficult to transfer the patient to the nearest clinic or hospital. We established this clinic to provide that home birth atmosphere to all our patients. Gentle birth is about welcoming the baby. I believe that babies have a superpower. When the baby opens his eyes for the first time, the baby looks like he knows everything. That moment is very special and very mysterious. So this is my photo, 23 years ago. And this is the first day after the birth. And this is my husband. And I recommend to have the elder children during childbirth. So I had my first birth at home. 6 years later, I had my second birth at a small clinic at which my older child was present during birth. It was a precious experience for her. I recommend that older children be present during the birth of their new sister or brother. Being present during the birth of their brother or sister is a very precious experience for them. That moment is once in a lifetime chance for them. That particular moment is very precious and mysterious, and it is very special for all members of the family to witness. It will be a very unforgettable experience for all the members of the family, most especially for the young children. This experience can be very motivating and highly educational for young children. I highly recommend that young children witness this once-in-a-lifetime experience. However, you must be aware of the risk of infection. Babies are very sensitive, so they can easily be infected with influenza or common cold. Another consideration is the incubation period. Some children might look healthy, but actually they have some signs of illness. This may also result to infection to newborn babies. So we don't allow to enter the second floor under 15 years old, except the elder children living with the newborn baby. Or do you have children? So it is first time? Okay. And this is my second baby and the first children. And so I don't set the length of stay, how long patients stay at clinic. So normally in Japan, 4 to 6 days after vaginal delivery, 6 to 10 days after cesarean section. And you can choose 1 to 14 days. And then the shortest was 6 hours or 8 hours. And yeah, because she wanted to give birth at home, so she wanted to go back her home earlier. I think American it's 1 day. Yeah, 1 day is normal. But for Japanese, 4 to 6 days, because Japanese people think that after the birth it's the very special, what can I say, mother need to take rest and then be cared intensively, so they can have power to take your newborn baby. It's the Japanese thought. And this is 5-year-old daughter holding her 2-day-old sister. And so it is a common practice in Japan that a newborn baby is separated from his or her mother after birth. The baby is then examined at the rack. After the mother sees the baby for a short time, he or she is then brought to the nursery. So I want to offer the kind of care that does not separate the mother and her baby. Early skin-to-skin contact is best after birth to support a gentle birth for both mother and baby. So, so the main thing that motivated me to open my own clinic was the practice I observed in the hospital I used to work. When the baby came out, we had to check the baby's condition at the rack before the mother and her child started the early skin-to-skin contact. I couldn't accept this kind of care. I wanted mother to hold her baby right after the baby is born. This action will assure the baby that the world is very protective, just like when he or she is inside the womb. However, if the baby is checked at the rack or separated from the mother, the baby might feel the trauma, or he or she will feel that the world is terrible. I want to offer the kind of care that does not separate the mother and her baby. In other words, I wanted to open an ideal clinic that would give the best care for both the mother and her baby. So we usually take photos for mother and baby after the birth during skin-to-skin contact, and then give them. I was starting to make a plan for a new clinic when I met an architect who practiced yoga and Ayurveda, traditional medicine. Ayurveda is a traditional medicine with historical root in India. Ayurvedic doctors regard physical existence, mental existence, and personality as a unit, with each element being able to influence the others. This is a holistic approach used during diagnosis and therapy. This is not only about medicine, but it is a holistic medicine that includes philosophies. Western medicine cannot be effective for common cold or influenza. Ayurveda has alternative approach medicine. So, according to the architect, exposed concrete for the interior of the building is not good for health. So he decided to cover the concrete with wood or plaster. And then we don't use any artificial chemical plaster, so there are no bad smell. So when the architect covered the concrete and the ceiling with plaster, He didn't use any adhesive. And this building was completed in November 2011. So I will explain about skin-to-skin contact. The newborn baby is placed directly on the mother's chest after birth. According to American Academy of Pediatrics, breastfeeding and the use of human milk, healthy infants should be placed and remain in direct skin-to-skin contact with their mothers immediately after delivery until the first feeding is accomplished. Delay weighing, measuring, bathing, needle sticks, and eye prophylaxis until after the first feeding is complete. So we practice our skin-to-skin contact at our clinic. The mother's deep body temperature is around 38 degrees Celsius, 100 degrees Fahrenheit, and it is warm. It is warm even if the room temperature is 77 degrees Fahrenheit. The outside world is cold for babies, so before the baby comes before the baby comes out, we turn off the air conditioner. When the room temperature was cold, we turn on the heater. When the newborn baby are placed on their mother's bare chest, they tend to be quiet for a while and they are gradually awakened. Then, within an hour, the baby will move on his mother's tummy by himself to find the mother's nipple, and the baby will start to suck. It is said that skin-to-skin contact should be done for at least 1 hour to 2 hours in order not to disturb the baby's natural behavior. Babies try to reach their nipples with their own power. Sometimes babies may pass the nipples so the mother can help the baby. After the placenta delivery, during a maternal treatment, such as during perineum suturing, etc., mothers can hold the baby for about 2 hours before measuring the weight of the baby, putting the clothes on, and so on. In the meantime, the hormone called oxytocin works in the mother's body. The body is short-sighted because the baby can see well within 30 centimeters, 12 inches. The baby can see the parent's face if their parents close their face to the baby. When the newborn baby are placed on their mother's bare chest, they tend to be quiet for a while and they are gradually awakened. Then, within an hour, the baby will move on her mother's tummy by himself to find the mother's nipple, and the baby will start to suck. So it's the contrast separation versus skin-to-skin contact. Crying is an infant sign of stress. As much as possible, do not make an infant cry. This is the result of separation from the mother after birth. And oxytocin is the hormone secreted by the brain. It is also called love hormone. When the mother sees her baby for the first time and feels that motherly care towards her baby, a motherly care towards her baby, Oxytocin works at that time. During the lactation time, oxytocin is secreted in the mother's body, brought about by the baby's sucking. So oxytocin is called the love hormone. Early skin-to-skin contact has good effect to the babies. Some of the positive effects are the following. And this is a summary. And we don't do those kind of routine care until 2 hours after the birth. We take care of mother and her baby at the same time. We do it as much as possible. So we transfer mother and baby together after the C-section. So this is the effect of skin-to-skin contact for breastfeeding.
When circumstances allow, uninterrupted contact is also possible in the event of a cesarean. Without warning, he is lifted out of his mother's womb. After thorough drying, he is put skin to skin with her during the operation. Now everything will feel much better. He's reassured by familiar sounds and smells and can start searching for the nipple at just the right time. This sturdy little fellow finds his way quickly and gets down to business right away. Even after the operation is over and the mother is moved to recovery, baby stays with her. The midwife gives a helping hand. While mother is under post-operative observation, father is responsible for baby when the midwife leaves. Sometimes a mother isn't available straight away. Then father's chest can provide warmth, security, and the sound of a heartbeat. But regardless of how it came into the world, the baby should as soon as possible be placed skin to skin with mother, undisturbed. The baby stays warmest in a maternal nest like this. The skin temperature of a mother's chest increases when her baby is placed there, and the newborn achieves normal body temperature more quickly. Even a heated incubator will not raise the baby's temperature as quickly, not to mention being left alone in a separate cot. Low body temperature and crying uses a lot of energy and can result in the baby's blood sugar going low. Keeping her newborn close feels great for most moms, and it benefits infants in many ways, not least the premature ones. Babies who stay skin to skin cry less. The levels of stress hormones are measurably reduced in both mother and child, and the breast receive early signals to start producing milk.
So you can check this short movie, the word breast is best. So please check later with your family. And then this is another movie.
No, Ben. Oh, yes, he's trying to get comfy.
A special time for mom and baby.
What's a nice calm moment to share, and it's relaxing.
Skin-to-skin care is the practice of holding your baby belly down on your bare chest. Developed out of necessity for premature babies in South America, skin-to-skin is now greatly encouraged for all healthy newborns.
Pediatricians and nurses in maternity wards realized that this was not just for preterm babies, that in fact, as our medicalization of birth separated the mother more and more, that we actually had to make a conscious effort to bring that baby literally and physically back to the mother right from the moment of birth.
And it's just where they're supposed to be. You know, this is quite a transition coming out of the uterus. And this is about as close to the uterus as the baby can get.
While skin-to-skin increases the likelihood of successful breastfeeding, the practice is also recommended for bottle-fed babies, as it can help maintain body temperature, regulate breathing, stabilize baby's heart rate, help with blood sugars and weight gain, and help babies spend more time in deep sleep.
All those things have a huge literature at this point supporting that it's either as good as our very high-tech care, or in some studies actually better than our high-tech care.
Another encouraging finding, babies who are snuggled this way cry less.
So lots of moms that have babies that are even fussy, we recommend even more skin to skin because of this relaxation hormone that goes on, stressor hormone down in you and the baby, and it calms the baby.
While infants crave this type of cuddling, there are profound bonding and emotional benefits for mom.
Mothers feel more competent. They feel more that they are able to provide for their baby. That there's also evidence that they are able to read their baby's cues more accurately, that they're more sensitive to their baby's needs.
And for dads,
it's very relaxing. It's very calming. There's nothing like a baby sleeping on you to really relax you.
And if you're wondering whether too much skin-to-skin contact can spoil a baby, Dr. Johnson says quite the opposite is true.
Newborns need to know that when they are uncomfortable or when they need something or when they're distressed, their needs are going to be met and they're going to be held. That security and that dependability of a response to their needs is what builds the foundation for a secure, competent, confident individual.
For CNN, I'm registered nurse Linda Champa.
Oh, hungry?
So it's recommended that the hospital staff should support mothers and babies to start skin to skin within 30 minutes after birth and to continue for at least 2 hours after birth or until the infant ends the first feeding. Further studies and the establishment of the criteria are necessary. So we facilitate skin-to-skin contact during C-section. Skin-to-skin contact during the cesarean section on the operating table with the baby's family. So family member can stand by during the operation. When the baby comes out, the mother can start holding the baby up for this early skin-to-skin contact until the entire C-section procedure is finished. Actually, I use that time to make the wound clear, beautiful. So it takes about more than 20 minutes just to check the surface. The last part is very important for the patient, for the cosmetic. Usually, so C-section takes about 30 minutes or so, and then usually I need 20 minutes more to for the surface skin. And baby sucking the nipple during the operation. And this is the photo by father, early skin-to-skin contact. So we recommend skin-to-skin contact with the father after baby starts sucking the mother's nipple, about 2 hours after the birth. During the early skin-to-skin contact by the father to his baby, the oxytocin hormone are secreted in the father's body and result to the father developing that strong bond and attachment to his baby. So I recommend for all fathers to have, but after the mother's first, and then after sucking the nipple, and then so after that it's father's turn. So you can do skin-to-skin contact anytime. In an event that the baby or the mother cannot do the early skin-to-skin contact right after birth due to certain reasons, it is possible to do the early skin-to-skin contact anytime when both the baby and the mother are in perfect condition. This is to establish the bond between the mother and her baby. So until this slide, I explained about early skin-to-skin contact, and then from now, I teach about breastfeeding. Do you have any question? No? Okay. Okay, so I will use the questionnaire so later, and breastfeeding and child health, there are many evidence that breastfeeding protects children against many diseases. And improves neural development. If the mother shifts from breastfeeding to formula feeding, the baby will have high risk of the following disease. Breastfeeding is very important because its long-term effect reaches to adulthood. Breastfeeding reduces the risk of contracting the following diseases in adulthood. So lower blood pressure, lower insulin resistance, lower leptin level, lower cholesterol, lower risk of coronary heart disease, lower risk of cerebral vascular disease or others. And the following are the advantage of breastfeeding to the mother. While breastfeeding, the mother burns 400 kilocalories. It is suggested that the mother consumes 2,400 kilocalories a day. Carbohydrate intake should be limited to 50%. Taking good protein and vegetables is highly recommended during breastfeeding. So that diagram shows the difference between the formula milk and breast milk under the microscope. As you can see, there are many live cells in breast milk. 80% of these cells are macrophages. Macrophage cells are white blood cells that can fight against harmful bacteria and other foreign substances. You can check so many cells inside breast milk, but nothing in formula. Breast milk has many factors that can fight against infections, and these factors are not present in formula milk, or the amount of is very small. So yeah, inside formula there are no secretory IgA and other nutrition are very small, and there no enzyme inside the formula. So this is the research checking the bacteria inside breast milk. So square, these bacteria do not cause any disease. Square and circle, these bacteria cause disease. In the triangle, this breast milk doesn't include bacteria. Then empty, the milk is stored in a cool place, and the solid, the milk is frozen. And stored for 8 days. After that, the milk put in the room temperature, and only the frozen milk in the frozen milk increase bacteria, but others are not so. But others, the bacteria didn't increase. So it means the breast milk, inside the cell breast milk can attack the bacteria if the breast milk are not frozen. So frozen mother's milk should be thawed by running water, not by microwave oven. And we don't use microwave oven because we don't know the effect, and some information says that microwave oven destroy the nutrition. So we don't use that in this clinic. And this table shows the length of time we can store breast milk. Fresh milk at room temperature. So for the healthy infant, we can store 6 hours. And fresh milk in the refrigerator, we can store the milk for 8 days. And thawed milk, we need to use the breast milk within 24 hours, because after frozen, the cells inside breast milk are destroyed. So the cells can't work until to the cells no bacteria. And if you keep the breast milk inside freezer, so you can keep breast milk for 12 months. And we never recommend heating of breast milk using a microwave. If the heated breast milk is not fully consumed by the baby, we can still keep that milk in the refrigerator at 4 degrees Celsius, 39 degrees Fahrenheit for 4 hours. So this one. So if baby can't consume all, so we can keep the breast milk inside the refrigerator for 4 hours. And after that, you can give the breast milk. So we don't need to waste the breast milk. The picture shows the separation of the fat component in breast milk. The separation of fat is normal. It is suggested that you shake the milk before giving it to your baby so that all the components will be mixed up. However, please shake the milk gently so as not to break the components in breast milk. Fat ball will be broken if you shake strongly. So let's check the answers to the questionnaires I gave you at the beginning. So please read this. question, please.
Should I give the baby water when baby looks thirsty?
And so the answer is no. So newborn baby and infants do not need any water or fruit juice. They need only the mother's milk or formula. For the first 6 months, the baby needs mother's milk only. So, may I request a volunteer to read this article? Yes, please.
Introduction of complementary feedings before 6 months of age generally does not increase total caloric intake or rate of growth and only substitutes foods that lack the protective component of human milk. During the first 6 months of age, even in hot climates, water and juice are not necessary for breastfed infants and may introduce contaminants or allergens.
Thank you. So next question. Please read this.
Oh, should I give the baby a pacifier?
So what do you think?
No.
No. So the answer is no. So with the pacifier, the baby may be at risk of developing reversed occlusion, bad alignment of teeth or otitis media. And finger sucking is okay because it is done by babies themselves. But using pacifier, and especially if the parent put the pacifier to the baby's mouth, it means baby can't cry naturally. So I think it's better to save the baby's intention. And then, so pacifier avoid the breastfeeding. So WHO, UNICEF, have you heard 10 steps to successful breastfeeding? It's the recommendation for the hospital or clinic to support the breastfeeding. And then this is the 9th, and give no artificial teeth or pacifier to breastfeeding infants, because those artificial teeth or pacifier avoid breastfeeding. So given the documentation that early use of pacifiers may be associated with less successful breastfeeding, pacifier use in the neonatal period should be limited to specific medical situations. And have you heard about nipple confusion? So try not to use an artificial nipple or pacifiers. If you use an artificial nipple, the baby sometimes stops suckling their mother's nipple. The way the baby puckers up may damage the mother's nipple. The opportunity to suckle the breast decreases because of suckling the pacifier instead of mother's breast. So next question, please.
Will the baby cry at night even if enough breast milk is given?
So the answer is yes. So when the baby cries but doesn't latch the nipple, that means the baby is not hungry. The baby just wants to cry. Please do not worry if your baby cries continuously. Just make sure that everything the baby needs is provided. Do not shake the baby too much to avoid baby's brain blood vessel injury. And this book includes many things about nursing. And this is also. So next one, please.
Will mother's milk continue to provide sufficient nutrition after 6 months from birth?
So the answer is yes. So some people think that if the baby started the food, so the breast milk nutrition decreased, but it's not true. So the quality of breast milk does not change After 1 year, it changes in accordance with the baby's growth. So this is lysosome in breast milk increase from 12 weeks after birth, and then it's keep the high after 12 months. And IgA is a very important element in breast milk. It strengthens the immune system of baby. IgA's role is like a missile. It attacks harmful virus and foreign elements from entering the body. So the concentration in breast milk is very high in colostrum, but the amount of IgA intake of children, 1 month, so the colostrum is high concentration, but after that, the baby's intake of breast milk is increasing, so baby can take enough IgA from breast milk. And babies should take breast milk as long as they can. Take note that the baby's intestines cannot take lots of nutrition until 18 months. Make sure to provide the baby with breast milk at least until then. So there are so many nutritions. So no significant decrease of protein, lipid or calorie from 3 months through 16 months. So that's why mothers should continue breastfeeding after 1 year. So the answer is yes. If the mother and child want to keep breastfeeding as long as possible. So please read this article. Please.
Breastfeeding and the use of human milk. The AAP recommends exclusive breastfeeding for about 6 months, with continuation of breastfeeding for 1 year or longer as mutually desired by mother and infant. The recommendation concurred to by the WHO and the Institute of Medicine. Mothers should be encouraged to continue breastfeeding through the first year and beyond as more and varied complementary foods are introduced.
Thank you. So next question. Is it true that the mother who breastfeeds cannot take any medication? The answer is no. So if you have, although more than 70% of package inserts say they are contraindicated for breastfeeding women in Japan, what's really contraindicated are anti-cancer agent and radioactive isotope only. So you may take medicine during breastfeeding period, example cold tablet, antibiotics, painkillers, allergy medicine, and etc. So if you have any question about medication during breastfeeding, please don't hesitate to call or email us and ask. And will breastfeeding at night cause baby's teeth to decay? No. The answer is no. So mothers should be conscious of the food they eat with their babies. They should consider the kind of food they give to their young ones. I want to emphasize this because we have encountered a case where the baby didn't show his teeth at the age of 1. The mother was worried, so she consulted a dentist. The dentist found out that the mother gave her baby fruit juice every day, thinking that it was healthy. However, the juice actually dissolved the baby's teeth. Juice will be oxidized immediately after it has been made, so you should give homemade fresh juice to your baby as soon as possible. Not use the sold juice, so it's not good for baby's health. And let me introduce Epios water. Have you heard of this? So it is the electrolysis function water, which is made from only water and salt and is refined. When the protein in the teeth is broken down, it smells of the antiseptic solution. If the dirt in the mouth decreases, the smell decreases, but breath decreases too. It is very good for periodontal disease prevention. And this is how to use aqueous water. And then you can get this at the reception. And the price is 2,000 yen and 500 yen for the bottle charge. However, you may bring your own bottle for your next purchase, so you do not have to pay for the bottle charge. And for pregnant women, it costs 1,000 yen a bottle charge during pregnancy. And so I will introduce the elimination communication. Have you heard that? So you can use diaper to have elimination communication with your baby, but you can raise baby without the diapers, provides the opportunity to train for the sense of exertion. It also reduces diaper rash. So I put this book at the clinic, so you can check the detail with this book. And you can use this kind of pots, or use the toilet with baby. And then please hold baby with sitting. So if you hold baby with your arm, only your arm, it's very difficult to hold so long time. So you can sit the what can I say? The seat the opposite side when you use. So and then hold the baby. So you can hold baby for a few minutes, and then if you observe the baby's way, so if the baby wants to pee or still, you can wait, and then after finish, baby can baby move, and then you can know the elimination finished. And next question about the smoking. So if mothers are unable to stop smoking, should they stop breastfeeding? The answer is no. So even if mothers smoke, they should think about the advantage of breast milk and should continue breastfeeding. So these are the maximum volume. This one. So a glass of wine, a glass of beer, 1 box of cigarette, or 5 cups of coffee in a day. So the mother can continue breastfeeding even if she takes those bad elements. So everything you ingest is introduced into your breast milk. However, if you take bad elements or medicine, you should continue breastfeeding for your baby's health. So, what do you think? Mothers who cannot stop smoking are bad mothers? No? Okay, so it is not the mother that is bad, but the smoking itself. Learn more about passive smoking on page 107 of that book later. Please check. So in the other references section. And so if the mother be pregnant, do they need to stop breastfeeding? So the answer is no. So if the mother is breastfeeding during pregnancy, it is important that she takes a lot of nutrition for the baby, herself, and the fetus. I would like to correct my misconception that if the mother continues breastfeeding in her next pregnancy, it will cause preterm delivery or miscarriage. Some physicians believe that during breastfeeding, oxytocin hormone is secreted and it can cause contraction of the uterus that may cause preterm delivery or miscarriage. The fact oxytocin hormone can contract the uterus after the 36 weeks pregnancy, so you don't have to worry about continuing breastfeeding your elder child during pregnancy. So next question about the food. So while breastfeeding, if the patient the patient need to avoid eating, mothers need to avoid eating anything fatty or oily food such as cake or tempura. So the answer is no. Eating fatty food isn't necessarily the cause of a blocked milk duct. It is reported that the main cause of mastitis is stress. So you don't have to limit your diet during breastfeeding. But pregnancy is a good time to reconsider proper nutrition. I have been able to read a very useful book for good nutrition. This illustrates the diet used by this world-famous tennis player. Do you know this book? So he quit eating wheat product, and then he could be number one. And yeah, this book says that he's experienced, but it's very good. It has a very good, what can I say, recommendation. And there are 6 harmful foods. You need to avoid those harmful foods. GMO and glutamate, artificial sweeteners, fructose, glucose, liquid sugar, synthetic dye, refined vegetable oil, trans fatty acid. And those are the materials which cause inflammation of the bowels. Tap water includes heavy metal. So it is recommended to use purified drinking water at home. Be aware that for all chemical reactions occurring in the body, various kinds of enzymes are essential. Vitamins, minerals, dietary fiber, protein are also important. Even a lot of nutrition and nutrients do not turn into energy without enzyme. However, when a person takes a lot of sugar, the sugar consumes the enzyme inside the body that results to shortage of energy. Most people think that when they feel tired or they lack energy, the best remedy is to consume sugary food. However, this idea is wrong. The effect of sugar to their body is totally opposite. The sugar eats the enzyme in their body. That results to lack of energy. You should avoid these chemicals as much as possible. Swallowing fruits, seeds, like the ones from watermelon, orange, and other big seeds can be bad for your health. So if you feel tired, nuts and fresh fruit, vegetable and fresh fruits, it's okay. And especially fresh fruit and vegetables include the enzyme and it can support your energy. It is the purifier we recommend. The system is very simple. this shower head is used by the mother during her stay in the clinic. This shower head is a purifier, so it removes chlorine from the water. We set a purifier for baby's bath as well. Fluorochlorous, we use this fluorochlorous when we give the babies a bath. So we don't use soap because soap is chemical also. So we just use this cloth. And then using covering baby. So, fluorochlorous cotton is originally grown, carefully hand-picked and hand-spinned. It is warm and friendly to both people and the ecosystem. Cotton is organic, which means it is cultivated without using agricultural chemicals or fertilizers. In addition, each cotton is picked by hand, spinned by hand to make a thread. For that reason, the twist is not uniform and the surface is a flatty finish. Moreover, dirt can be removed from cotton fabric without using any detergent. One of the secrets is that the maternal can absorb maximum extent of water. And this is rice oil. And in water, so this is the bath salt. It's very good for make your body warm. And next question. So this I will explain about the system how the breast milk secrete. So if the mother don't release their breast milk for 3 days, the breast milk secretion will stop. So milk production begins after the placenta is delivered. The numbers below show the postpartum date. It shows that for the first 3 days, the amount of milk produced by the breast milk is minimal and it increases gradually. During the pregnancy, female hormone estrogen and progesterone block the secretion of milk from the breast. When the placenta comes out during delivery, the influence of estrogen and progesterone will stop and milk will start to be secreted from the breast. Oxytocin and prolactin will start to work after the delivery. Due to hormonal changes, 7 to 10 days after the delivery, the secretion of milk is under the control of endocrine hormone. So, please.
After 7 to 10 days postpartum, mechanism changed to autocrine local regulation. Reproduction is controlled by the infant's needs and maintained by removal from the breast. It is important to feed or express until the mother's feels the breast is well drained. Milk stasis for a prolonged time leads to FIL feedback inhibitors of lactation elevation, which will suppress secretion.
So, can you understand the system? How the breast milk control. So just after the birth, the milk production is owed to the hormonal system, and then after 7 to 10 days, the milk production owed to the local system, and then inside breast milk, the milk includes the pill. So pill suppress the milk production. So if the mother keep the breast milk inside breast, so pill work and then to suppress the breast milk production. So mother need to take out the breast milk well drained. Okay. So please read.
Oxytocin. Oxytocin is a hormone in the brain. It works during labor. It also is responsible for the secretion of breast milk. Furthermore, oxytocin has a relaxing effect. It can help to develop trust. Oxytocin secretion increases when the mother is relaxing. When a mother is looking after her baby during her relaxing time, the oxytocin level increases. However, if her brain is preoccupied, like when she's doing some mental calculation, the level of oxytocin decreases. Recently, many mothers are preoccupied during their nursing. They do certain activities like watching TV or using their smartphones. These actions are not suitable since babies need their full attention. During this time, it is very important they establish eye-to-eye contact with their babies to develop the early bond between them. Babies feel relieved when their mother concentrates her attention on them. This is the first step for babies to learn the communication.
Thank you. So oxytocin hormone is very special and then can help you relax. And there are several roles to relax. And pitocin is oxytocin, but pitocin can work only to the uterine. So the medicine doesn't have the effect for the mental relax. So I usually I don't use pitocin before the labor pain occur because the pitocin work very make the strong pain, but sometimes I use the augmentation. So after the labor pain occur and then the course is too long and then so mother is too tired. So sometimes it help effective, but I can discuss whether they use the medicine or not. And then the situation, the mother have the water break and then a few days we wait, but the labor pain don't come. So sometimes we do the induction, but I usually use other kinds of medicine. I don't use oxytocin before the labor pain occur because oxytocin is not effective until the uterine cervix matures. So this is the summary, the mechanism of breast milk. Could you read this?
After the placenta comes out, breast milk secretion will begin. If mothers breastfeed frequently, prolactin is secreted and the milk production increases in the breasts. The hormones related to the breastfeeding are prolactin and oxytocin. Oxytocin can work to make you relax. If the nursing interval is long, prolactin level decreases and breast milk secretion decreases.
Okay, so can you understand the system? How the breast milk product. Okay, so next question. Should I let the baby cry alone? Otherwise he or she will want to be held constantly. So the answer is no. So it's better not to leave the baby. So infancy is the time to develop a basic trust. So play with and always hold the baby, So it's very difficult for mother if the mother only take care of the baby. So mother needs the help to take care. And then mother needs to take rest. So you need to ask someone to help the raising baby. So could you read this?
The thought that you should not hold your babies too much because you might spoil them is a thing of the past. In fact, not holding your babies frequently may cause an eating disorder, overeating, or apopliosis in the future. Moreover, leaving your baby to sleep by themselves may cause them to develop some psychological problems.
Thank you. So,
as a result, there will not be an attachment that will develop between the parents and the child. It is hard for the baby to have negative feelings if they are accepted by their mother. Children who have experienced being accepted can easily build trust with others.
Thank you. So, mother and baby interaction breast is like a second placenta. So, human baby are premature. They can't stand by themselves, so they need the breast. Think of the breast as a second placenta. Baby are connected to the placenta with the umbilical cord, taking in nutrition and oxygen. After birth, they get nutrition from breast. Babies can feel the mother when they are breastfed frequently. They can learn primitive confidence. So, avoid sudden infant death syndrome. Breastfeeding, avoid passing smoking, avoid sleeping on stomach. So it's the way to avoid sudden infant death. So it's difficult to take one's eyes off of the baby during breastfeeding. Frequent breastfeeding can give frequent touch and stimulation. Baby don't sleep well when breastfed and can wake up more easily. So if the baby take formula, it's very difficult to digest comparing to breast milk because of the difference of the protein, kind of protein. So it takes time, and then baby need to use energy to digest, so baby need to sleep deeply. So for the mother, if the baby take breast milk and then put the baby on the floor, and just after the putting on, so baby cries, so it's very hard, and then sometimes baby mother thinks baby sleep for as long as they are longer, so they need to do the housework or so many things. But the other side, baby can't sleep deeply. It means baby can awake and then avoid the sudden infant death. So there are several sides. And resilience is a technical term in psychology. It is opposite of vulnerability. Resilience is the concept that they can heal by themselves. So how to develop resilience in children transforms a woman into a mother and a man into a father. Don't ignore your children. Hold them whenever they need. Praise your children. Children can feel accomplished if their parents praise them. Always be positive in front of your children. Children imitate their parents. Let the children exercise, chew their food well, and live a well-regulated life. Make good memories with your children. Discipline your children by teaching them your traditional culture and teaching them how to manage when they face difficult situations. Consider your children's welfare at all times. Make them feel that they are loved and valued. There are times that Baby want to be held by their parents. If the parents ignore these signs, the baby's brain will be injured. So do not leave the babies behind for the protection of their brains. And reading books to children is very good for grown-up children and to bond with them. However, if the children cannot concentrate during reading time, it is best to read some books during bedtime. Reading is not only good for the children, but to the parents as well. Study shows that reading aloud increases the blood flow in the frontal lobe for adults. Attachment parenting is a parenting philosophy that which aim to promote the attachment of mother and infant not only by maternal empathy and responsiveness, but also by continuous bodily closeness and touch. In family sociology, attachment parenting is considered to be the most striking manifestation of intensive mothering. So, does anybody want to go to the bathroom? Okay. So I want to teach about the media exposure. So television and the smartphone affect the mental and language development of the child. So exposure to television or smartphone before 2 years old may lead to a delay in his or her mental development. Moreover, letting children under the age of 2 years old watch TV and use smartphones affects their language development. So bad influences on children from media are these effects occur. During infancy, the brain is still in a formative stage. Infancy is an important period for developing communication and language. So it's better we do not use these kind of toys for babies. Could you read this?
Media and young minds. For children younger than 18 months, avoid use of screen media other than video chatting. Parents of children 18 to 24 months of age who want to introduce digital media should choose high-quality programming and watch it with their children to help them understand what they are seeing. For children ages 2 to 5 years, limit screen use to 1 hour per day of high-quality programs. Parents should co-view media with children to help them understand what they are seeing and apply it to the world around them.
Thank you. So there's a recommendation. It's the article, and there are some. What can I say? Article using smartphone. I mean the harmful effect of the using media. So we need to choose how to use. And Yui Clinic provides a friendly space to connect with one another during pregnancy, birth, and postpartum. Creates an environment much more like a home and not an unfamiliar hospital. We feel that by welcoming a new life into a nurturing environment, it provides a good start to a life full of possibilities. So what I think is important to create a facility supporting the emotional and physical needs of mother and her baby, to create a safe, supportive, home-like environment for you and your family. Gentle birth, not overstimulating the baby. Grooming method to support bonding between mother and baby. support breastfeeding. So we support mothers and the baby. The mother and baby bond will spread to family, society, and into the future. So we usually take photos after the birth. If you have any troubles such as inadequate milk taking medications, mastitis, appropriate milk production, or breast pain, Yui Clinic will continue to support you until you stop breastfeeding. If you have any trouble, please don't hesitate to contact us. We can provide support during the whole day, even at midnight. Yeah, you can call to the midnight. And we have the translation telephone service, but so if the midwife can't speak English, they will call back with using the translation service if you have emergency. And then these books are about breastfeeding and very good, so I recommend this. And then I put these books at the waiting room. And then I'm leche meeting
we don't have a leche here actually. We need to get it started. I've talked to the lactation consultant about getting it started. But so in the works still.
Okay. So I understand that this lecture has been information overload to you. However, the information is very important, so I encourage you to review the material that have been provided. Moreover, I believe that you have a great chance to be professional in the field of breastfeeding and taking care of your baby. Actually, pediatricians and obstetricians are not experts on breastfeeding, so I believe that you and your experience are the best source of information about breastfeeding. The book I have just mentioned is the best source of information about breastfeeding as well. I'd like to thank everyone for coming here today and for participating during the lecture. I appreciate everyone's effort. If you have any questions and suggestions, please do not hesitate to ask us. And I have a questionnaire, so after the class, please write down if you have any impression and question. And then I asked Rachel today to have discussion after the lecture. I'm sorry, I over the time. And so let's have a short rest until so a few minutes, 2 or 3 minutes, and after that, please have a discussion with Rachel today. Thank you very much.
Want to get up and stretch, moms? I'm not going to use the microphone, okay?
Okay, so some discussion. So I have a meeting upstairs, so if you have any, so please tell the staff at the reception.
Okay.
So, yeah, you can use the...
Do we have a restroom here?
Yeah,
up front, yeah.
Until I will go. Okay, I'm sorry. It's okay. So, take the invitation.
Yes.